I had a Lyme disease patient who was not recovering. He had taken antibiotics for Lyme disease. He wasn't doing very well. I'm discussing this case as part of a common sense Lyme disease series. These are cases I see in my practice, questions that get raised in my practice, and I'm Dr. Daniel Cameron, so welcome. This was a 23-year-old young man who was treated for Lyme disease. He was still sick. He still had exhaustion, brain fog, headaches, neck pain, and POTS. He expected antibiotics to be enough, and he was frustrated. He hadn't realized that you have to make lifestyle adjustments to support this recovery. He still somehow was out at night. He had a poor diet. At least he was out at night, but with that poor diet and no focus on hydration or movement, he was not in the right environment for recovery. So he took on a shift in his approach. He was skeptical, which a lot of my patients are, especially when you're young. He decided to focus on a nutrition-based diet, reduce processed food, gentle walks, and staying away from alcohol. So he started turning the corner. He had brain fog that was lightening up, energy improved, headaches less frequent, his POTS had eased, and he started moving. He had mental clarity and more stamina. So the bigger lessons for him is that recovery isn't just a medical treatment. He had realized that if he added nutrition, hydration, movement, rest, and stress management, and probiotics, that he would do much better. So in this case, I always have to take time counseling patients because it's so easy for them to not incorporate health habits, movement, activity into their practice. Also, I find that it's important to reach the patient where they're at to bring them along on this treatment. And I found the antibiotics were more successful for him, and often find that's the case. So thank you for joining me for this common sense Lyme disease case. And if you have any questions, leave comments below.